Hi, my name is Brooke. I'm going to be your nurse today. How are you doing?
I'm good. I'm a little pain, but...
Oh, I'm sorry to hear that. Do you mind telling me your full name?
My name is Greer Schulte,
And your date of birth?
February 21st, 1992.
Okay, so I'm going to check your bracelets.
All right.
Make sure. And then I'm going to make sure I wash my hands and provide patient privacy. And then, Greer, today I would like to do a full head to toe assessment on you. Is that okay?
Yep, I give my consent.
Awesome. And then I'm just going to get your vital signs. Is that okay?
Mm-hmm.
So I'm going to get her blood pressure. I'm going to get her pulse rate, her respiration rate, and her pulse oximetry. And then I'm also going to notice her body position. She has good posture. Her skin color looks accurate to what it should be. She obviously is able to hear me, and her speech sounds good. And then when she walked in here, she had a good, normal, steady gait and no assistive devices or anything like that. And her hygiene looks as good, and she looks well nourished. And her skin color's good. And then, are you experiencing any pain today?
Yes, I got a sunburn, so my skin is quite hot, and then I'm having blistering from the sunburn.
Oh my goodness,
Yeah,
I'm so sorry.
Oh, thank you.
When did that start?
Well, this weekend I was doing yard work,
Okay.
and the sun hates me.
Goodness, I know I get sunburned easily too. It's no fun.
Yeah.
Has there been anything that makes it better or worse?
Lots of aloe vera gel and cold showers, and hot showers definitely make it worse, and then being back out in the sun.
Yeah, and then do you mind telling me on a scale of 1 to 10, what would you rate your pain?
I'd say a 2. It's more annoying than painful.
Yeah, absolutely. You had a sunburn.
Yes.
And you said that it started, was it this morning?
It was, I think, Sunday.
Sunday, okay. And then, does it radiate anywhere? Like, can you tell me the location?
Oh, yeah, just on my back and shoulders. It just kind of sizzles.
Okay, so how would you describe it? Like a dull pain, sharp pain?
More sharp.
Okay, and definitely on the surface?
Mm-hmm. Yeah.
Okay. And then also, can you tell me where we are today?
We are in the nursing building.
Okay, and what are we doing?
We are doing our health assessment, head to toe.
Excellent. She's oriented ×4. She person, place, time, and thing. Oh, and then what is the month?
We are in May.
And then, if it's okay with you, I would like to just take a look at your head and your hair and everything. So, her hair looks good. I don't see any bald spots. I don't see any lesions or bumps. And then I also noticed that her skin looks good as well. And then if I can check your and your lymph nodes. So I'm gonna start with the lymph nodes up here in front of the ear, and then also behind the ear, and down and then submandibular and submental. I don't feel any hard lumps or anything abnormal. And then there's also the cervical chain of lymph nodes, and then I'm also going to check the supraclavicular. I again don't feel anything abnormal. Also, her skin is dry. It's warm. It is a little warm from the sunburn. And then I want to check your eyes. So I have a pen light here. Okay, So I'm going to check her pupils. They look equal and round, about 3 millimeters. And then I also am going to check the reactivity. So just look straight ahead for me. Perfect, they both constrict. And then I'm going to check the reactivity as well as I go in towards her nose. So just look out in the distance for me towards the pen light and then watch it as it goes in. Perfect. So they're reactive, and then I'm also going to check the 6 cardinal fields of gaze. So just watch the pen light for me. Okay, perfect. So I don't notice any shaking, involuntary shaking of the eyeballs. And then I'm also going to check her nose. It looks symmetrical. I don't notice any deviated septum. I'll also use, I'll just use the pen light, but I'm going to check her nostrils to make sure everything looks good. It should be red and moist. And I'm going to check the patency of your mirrors. So if you don't mind plugging one side of your nose, breathe in and out. And do the other for me. Okay, so there's airflow, which is great. I'm going to check her mouth and her teeth. So you mind opening for me? And her mouth looks good. Her tongue is pink and moist. So let's see. I'll put gloves on for this one. So I'll use a tongue depressor. Actually, and first, will you stick your tongue out for me? Move it side to side. Okay. And then I'm going to check the nasopharynx, or the oropharynx, I'm sorry. Say ah.
Ah.
So I checked that the uvulum moved up, so that's good. Uvula, sorry. And then I'm going to check her buccal areas, which are moist and pink. Her teeth look good. And I'm also going to, her lips also look good as well. They're pink. Oh, and then I also would have checked her gag reflex, so I would use the tongue depressor and check her gag reflex.
But
Okay, so she's good. And so then I'm going to check her facial symmetry to check those cranial nerves. Smile for me, okay, and puff out your cheeks. Okay, and raise your eyebrows. Okay, so she has good facial symmetry. Yours.
Okay.
So I'm checking the pinna. I'm making sure also behind the ear if there's any lesions, lumps, anything abnormal. Her skin color is good there. And then I'm going to pull, since she's an adult, up and back. And I would take an otoscope, but I'll use this just to make sure. And the tympanic membrane should be a pearly gray color. It looks good. Let me check your other one as well. Alrighty. And I'm just going to have you shrug your shoulders against my resistance. Perfect. And then, so I'm also going to notice her respiratory rate. I did get her respirations earlier, which are normal, 12 to 20. And then her rate is steady and doesn't seem to be like a lot of effort. And then, if you don't mind, can I listen to your heart sounds?
Sure.
So I'm going to listen to her heart sounds. I'm going to use the pulmonary, the aortic, and then there's also the mitral and the tricuspid. I'm just going to do that real quick. Okay, and then I'm going to check the apical portion and count her apical pulse for a full minute. Okay. And then, let's see. I'm also going to listen to your lung sounds. Is that okay?
Oh, yeah.
So there's 6 on the front and 6 in the back, anterior and posterior. Okay, so I want you to take a deep breath for me. And these are just the lower lobes. Okay. And then I'll do her back. Take a deep breath for me. Okay, so no adventitious sounds. Lung sounds normal. And then I'm also going to check your kidney tenderness. I want you to let me know if you experience any pain or tenderness. All good? Okay, excellent. And I also want to check, can I check your hands real quick? So I'm going to check her cap refill, which is excellent, less than about 2 seconds. And then her turgor, her skin turgor, which is good. It's supple, and as well as your pulses. So I checked your apical pulse, and then I'll check your wrist pulses, and I'll check both of them. And then I will check your carotid pulses as well, if that's okay.
Mm-hmm.
I'm only going to do one at a time. And then I also want to listen for any bruits with my stethoscope. And I'll use the bell side. And take a deep breath and out. Okay, I don't hear any bruits, which is excellent. And then I also I want to test your strength. So I want you to hold my fingers, pull towards you against resistance, and push towards me. She is strong. Excellent. That is a 5 out of 5. And then push down and push up. Perfect. And then, do you mind laying down for me?
Oh, sure.
So now we're going to take a look at your abdomen. The order is a little different here. I'm going to inspect and auscultate prior to palpation so that we don't, because we want to listen to bowel sounds before making them, before activating them. There's a little hair on your belly.
Oh,
okay.
Thank you.
So I'm inspecting it. The skin color looks good. The skin is dry and warm. And then I'm just going to listen in all 4 quadrants. And I would be doing all 4 for 5 minutes if I don't hear any bowel sounds. Right upper, left upper, right lower, left lower, and I heard bowel sounds in all 4 quadrants. We're good there. And then I'm going to lightly palpate. Let me know if you have any tenderness or pain.
Okay.
I'm just checking for any masses, lumps. I'm also taking a look at the skin seeing if there's anything abnormal like moles, anything like that. And now I'm going to do some deeper palpation. Just let me know if you feel any pain. Feels tender, or not tender, feels good. Okay. And then I also want to ask, have you, what was your last bowel movement?
Last night.
Okay, and have you been voiding all right? Okay, have you had any pain, itching, burning, anything with that?
No.
Okay, and since she has a uterus, I'm also going to ask about menstruation. Have you had any irregularities with your menstruation cycle?
No, I had it last week.
Okay, good. Alrighty. And you can sit back over me.
Right.
So now we're going to check your legs and feet, if that's okay. Just sit for me. Normally she would, take her pants off and stuff like that, but
I wear my anatomy socks.
I love it. Those are so
for
cool.
the occasion.
Okay. So I'm going to check for any edema in her lower extremities. Again, looking at her skin on her legs, seeing if there's any abnormal things such as lesions or wounds. And especially if she's a diabetic, I'm going to definitely check her heels. And I'm going to make sure the bottoms of her feet look good and there's no ulcers. Also checking for ingrown toenails. And then I'm also going to check the pulses. So I'm going to check this one back here. And the dorsalis pedis, which is right there. Perfect. I'm going to check the other one.
I'm sorry,
Okay.
my boots don't breathe.
You're okay. And I'm going to check your strength as well. So
Okay.
I want you to lift your feet up. Okay, and then push your feet down.
Push them down.
Okay, and then I'm also going to check your reflexes.
Okay.
So just fully relax for me. Perfect. Awesome. And everything looks good. So thank you so much
thank
for
you so much,
your
Brooke.
time. I'm going to make sure I document everything that I found and that was abnormal. And I'm also going to make sure I rate everything. I'm going to rate possible edema. I'm going to rate the pulses, which hers were +2. And that's it. Have a great day.
Thank you, you too.